Hello and welcome to the Days of Learning podcast. I'm your host, David Nelson, and it's what a joy to be here on this early fall day. The Days of Learning podcast, where we discuss health, wellness, medicine, and community engagement. Days of Learning podcast is sponsored by the Center for Disease Control and Prevention, the Wisconsin Department of Health, Milwaukee County Organizations Promoting Prevention, and the Medical College of Wisconsin. I'm thrilled today to have my good friend, Rosamaria Martinez. Rosamaria is the Vice President of Community Health Initiatives at the 16th Street Community Health Center here in Milwaukee. She's been there for 14 years. She is a Milwaukee native. She went to undergraduate at Mount Mary University and studied dietetics. She has her MBA from the University of Wisconsin-Milwaukee, and she is married and 2 children. And I have known Rosamaria probably since I came early to Milwaukee, and she has always welcomed me to her community. Ms. Martinez, welcome.
Well, thank you so much for having me today.
It's such a joy to be able to talk to you today. I see that you're sitting in your office, and so are you back off of COVID to working in the office?
Well, we're a community health center, so we're never, I was never far away. So I've been coming into the office during COVID to meet some of the needs. There are some days I was at home, but many days here.
You know, what a joy to talk to you today. And I want to get into the idea of the health of the Latinx community. But first, Rosamaria, tell us how you got to your position at 16th Street Community Health Center. Take us through your story.
My story, I've always liked health. I've always liked the medical field. I grew up in this neighborhood, very close, actually just about a mile down. When I was going to school, I knew that I wanted to be in the healthcare field. I didn't know exactly what role I wanted to be in. And so what caught my attention was nutrition, physical activity. I finished up my bachelor's at Mount Mary. I also, when I was done with that, I was actually very interested in public health. And at the time, we didn't have a public health program in Milwaukee. So I had little kids when I was looking to do my graduate degree. And so traveling to very far wasn't an option for me. So I ended up with finding something that I felt was going to help me personally and help me grow professionally. And so I went for my master's in business administration. When I finished, I worked for UW Extension for a little bit, and also was at the medical college for a short stint, and then I came back to 16th Street. So it's been a path of thinking through what was important to me. It was important for me to be in the community. I knew that. So when I was finishing up my undergrad and I was choosing what areas of nutrition that I want to work with, I knew community had to be a really big part of that. And so the Women, Infants, and Children's program was a natural for me. I loved it. I love it now. I believe in its mission and what we do, and I'm always impressed by what we do. I love working with kids, and so it was a natural. And so after my graduate degree, and coming back to 16th Street, we as 16th Street were creating a new department, Community Health Initiatives. And my predecessor was making some changes in his life, and this position became open. And for me, it was perfect. It was a marriage of public health, of community, of an agency that I really believe in, and growth. And so that's how I came here, and I love it. I thought it's one of the biggest gifts for me.
Yeah, we've worked together for a while, and we get together outside, and I have never heard you say really a bad thing about the work that you do, because you enjoy it so much and you always have a joyful smile on your face. I want to go back though, because you talked about growing up near where you work.
Yeah.
Tell us about that.
So I grew up about a mile east from here. Um, I, as I, my current building where my office is on the corner of 16th and Greenfield. We also have a clinic on 16th. I think it's between Scott and Monroe. And so it's like a 2-block radius difference. And so pre-COVID, when we'd have meetings, I would walk over there. And I tried to walk over there pretty often. I like doing that, getting in my steps and doing so in the community. And as I have as I walk over there, I also remember the steps that I took when I was young. There is a store that used to be across the street. I used to be right across the street from our clinic. And when I was little, it was just starting out. So it was a really small store, but I remember coming there and having bags of groceries that my mom and I myself would carry. We had one car. My dad always had it for work. So I would go with her to buy groceries and carry as far as we could. Would probably be every half a block we would stop. I remember in the Dental Associates building at that time, we'd probably sit right by, there was a little bench almost, and we'd sit right there where they had the plants then. So taking stops there, walking down back home, trying to carry our groceries as best we could. So that's kind of my experience of remembering this space quite a bit. And it has also reminded me, so as part of my role, well, not as part of my role, but in my role, I'm also part of the Harbor District, the board of directors for the Harbor District. And I am amazed on all of that's available, all the beauty that we have, all of the rivers right across. And so I didn't know that much as a child, but it's how beautiful and all the availability there is of opportunities in terms of rivers and water. It's just amazing.
Tell us about growing up in Milwaukee when you were a child. What was it like back then?
Well, it wasn't that long ago, David. No, it was, what I remember from my community was playing outside a lot. I remember having friends, my neighbors, going to their homes, knowing their parents. I lived across the street from Allen Field School, where I went to school when I was young. And we had a playground. So it was a huge playground basically at our dispense, so we can go ahead and use it. And so what I remember a lot is having time outside. Definitely was not inside very much when I was a kid. And utilizing that space as best we could. I come from a larger family. So although I'm the youngest, so many of them were moving out as I was growing up. But yeah, Milwaukee to me means a lot of friends and there's a lot of connections. And actually my son right now is when he talks to me about his friendships, I feel like I can totally understand, because I feel so important to me. As you grow up, you have somebody to talk to connect with. You see them through their stages, and it's interesting to have that lens now. Looking back on you look at it differently, knowing some of the struggles that some of our families go through.
You know, it's a good thing that we are friends, because when I say, take us back to your childhood, it makes it seem like you're ancient, and you are far from that. But I asked that because I didn't grow up here. And from when you were growing up as a child to what you see today, what has shifted? What has changed, if anything?
Well, when I was a child, the Menominee Valley was very different. That was not very inhabitable. That space has been redefined in many ways, and I'm happy to say that actually 16th Street had a role in that. And so I really appreciate my predecessors' vision and engagement in the community and what it could be, and not taking it for granted. in terms of other spaces, I mentioned one thing that I've realized is I was so close to the river. I'm really literally blocks away, and that was never really underscored or highlighted. I think that there was so much opportunity there that I just wasn't part of, didn't realize. So I don't know that it's different, but from my lens, there's a lot more available, and quite interesting to see that progress. And quite interesting to end up in an organization that had its hand in it, along with many others, right? But that's the lens that I see it from now.
It's good to hear, because oftentimes when we hear about metropolitan areas, we hear about the degradation and the decline of those areas. And you're actually saying, you know what, it's actually gotten better in some respects, and that gives us more opportunities to do things. And when you talk about community health, the out of doors, we want to have it to be free from pollution, perceived to be safe, and perceived to be inviting. And you're saying that there's a lot more to Milwaukee than probably meets the eye to many people.
Oh yeah, I mean, you could definitely walk down the streets, and I'll be honest. There are things that were there when I was young. Mitchell Street had Boston Store and Sears, and had the annual fairs, and so there is some things to be lost, and there's some things that we need to continue to work on, definitely. When I walk down the street, again, we did a lot of walking when I was young, and looking at those houses now, I mean, there's as an adult, I'd love to see better quality on some of those houses. But there's also a lot of good that has been done, and so I think from my lens, I see that hope, and I also do see that there's a lot of work to do still.
I'm glad you said that, because we all would acknowledge that there's a lot of work to do, and especially if we're thinking about the health of the community.
Absolutely.
Tell us about 16th Street Community Health Center for our listeners and our viewers who might not be familiar with what it is and what you do.
So 16th Street Community Health Centers is a federally qualified health center. We have 4 main clinics, including here and one in Waukesha. We also offer our medical services and behavioral health services in schools. And we also offer assistance for substance abuse. We do have a physical and occupational therapy program. As well, we have oral hygienists who work with us to help with some dental needs. So we are growing. We celebrated our 50th anniversary. And we're in it as other federally qualified health centers, is to provide high quality care to our patients and free of those barriers, trying to make it as easy as possible for them to come in and get serviced and receive utmost quality care. And so I mentioned medical and behavioral health. We also have many services that help address some of those social determinants. We have the largest single site women, infants, and children's program in the state, which serves over 6,000 participants. We have an environmental health department that works on lead outreach programs, and as well does a lot of work along the river. And we offer our social services, and we have a parenting resource center in the clinic, and a healthy choices program that really is aimed at fighting obesity and engaging in families, the whole family, and building leadership in our community on obesity.
So you mentioned the 50th anniversary, and you weren't there for the first anniversary. So let's be clear as I'm going down that path. But you have been there 14 years. You had said in 2 7-year stints. So you have seen a lot in the 14 years that you have been there. How has it changed in your time? And what do people who have been there longer say about the clinic from earlier days?
Well, we have a staff member who's our first staff member, and she's still here. She's celebrated 49 years with us.
Well,
So
we got to have
she's,
her on.
yeah, she's fantastic. So she's still with us. She's hoping to celebrate her 50th with us as well. And so she tells me some stories as well, reminded me of how, she was on when we were starting the Women, Infants, and Children's program, and how some of those days were really paper. Everything was paper. You wrote down everything. You gave them a check. You wrote it out. It was just so,
Scrap
she did a
paper.
lot of the work. Yeah. She did a lot of the work in helping engage those. So when I came in 2000, we only had, I don't think we even had a second clinic when I left in 2007. And so it was just some definitely hadn't grown as large as we had. We were very much a very small organization with a lot of heart. And so coming back years later and seeing the systems that we put in place as we grow and have more health centers was quite incredible. I loved it. I remember the days of having to print out checks for people for the Women, Infants, and Children's program, and now we have systems that are, for example, for that program, we have cards that the food benefits are loaded on the card, and so it's much better for COVID. I'll say that, but really growing the programs and being even stronger in the community.
I want to have some understanding of this. So you serve a large Latinx community.
We do.
And are your providers speaking Spanish to the patients if they so choose? Is that an option available for the patients?
Yes, definitely. And actually, I don't have the exact numbers, but the majority of our staff are from the community. I'm not an exception. I am part of our 16th Street family, and of that, many of our staff have lived down the street. They grew up in this neighborhood. They have families in this neighborhood. Their children are growing up in this neighborhood. So definitely bilingual is something that a service that we have. It is something that I remember my mom needed when she came to 16th Street, and was very helpful because it helps people understand where they're at. So and many of our providers also are bilingual, and we also recognize the need for interpretation sometimes, and so either the service is offered with some of our own staff, or we have interpreter services available for us if the provider is not bilingual.
I want to talk about the community, but we're not going to. I want to go back because you just said something that I really want to go deeper on. You said many of the staff have lived on this street. Their kids grew up in this area. Why is that important to your organization?
Oh, I think it's super important. There's value that you place. I think you have a specific care with something that you have helped grown. And it's to understand what some of the issues might be. We all know that health is not just take your physical health that is addressed just within four walls of any clinic. And so our staff, I think, are fully aware that there are many other needs and there are many other issues, and understand the whys to many of the concerns that many of our families have. And so there's value placed on improving and offering quality services. I will say we're also, 16th Street is also a Joint Commission accredited, which is we're the only federally qualified health center in the state that has that accreditation. And And so that, that's really important. There's very high standards that we have to meet in order to keep that accreditation. We don't take that lightly. And in fact, just a few weeks ago, we just received one of the awards from the Health Resources and Services Administration, so HRSA. So we are ranking on the top 10% of health centers for best overall clinical performance. That doesn't come just because we want it. We have to work for it. And I think that our staff, being from the community, are passionate about what they do. And when you have a passion and a love for what you do, I think that the quality will come with it.
You said something before that I made a note of. You said, it says the early days we had heart. I actually will say that you still have heart.
I do. Yes.
And those JCO standards, which are very high standards that very few organizations meet, that you meet those, as well as meeting the needs of the federal government. When a patient comes in,
yeah,
and they can speak the language of their choosing, what does that do for them and the relationship?
It builds relationship, right? It was recently, it's those little things that make a big difference, right? Brene Brown recently described trust as a jar of marbles, right? So, when you think of teachers and they have their jar of marbles, and when kids do something good, you put in a marble, and when it's not so good, you take one out, and when you reach that full jar, you reap some benefits as a classroom, right? She referenced it that way. And so it's those little things that add to that marble jar, right? And having and being able to ask those questions and connect with somebody in their language is very important. It allows for some connection and that some relaxation. I think you don't have to worry about, oh, are they going to misinterpret it? But there's just an innate kind of trust there that starts to build. And it's important. It's important health is complicated. It's like, it's not easy of take this pill, you're better. It's complicated. It's multifaceted. And to be able to dig down to some of those issues, it's important to be able to have that connection and try to break down any linguistic barriers.
I was going to say nuance for me, because it would be like, though I speak very little Spanish, it'd be like, here, tell me what you're feeling in Spanish when my first language is English. And I think it goes the other way as well, when even with interpretation, that it's like, no, you're not getting the essence of it right. You're really not describing it as I would describe it, but I don't know the words in that other language.
Right. Yeah, it's certainly complex, and it's different. Healthcare here is different than in other countries, in other Latin American countries. And so you're trying to understand not only in and of itself, even if you're born here and grew up here and know what the system is like, it's still complex. And so trying to understand it from a family that comes from a very different system is quite different. And so being able to offer as much as tools, as many as we can, to help comprehend where they're at and what their needs are. Because the best doctor for a person, or the best person to identify how their health is themselves, right? So to help describe that and get what's normal for them and what's not is important to understand.
No culture is monolithic, and that there is great variability and diversity. Can you tell us, just in your own interpretation, about the Latinx community that you are familiar with, the culture, the language, the customs? Let's start there.
Thank you for asking it that way, David, because you're absolutely right. It's super complex. I was just telling somebody the other day that I can only come and tell the story of my experience. The Latina experience is very different. I grew up here. My parents came here from Mexico back in the 60s. my dad was invited here through the Bracero program. So it was a very different way, right? He came when he was young. He worked in many of the different fields in California and Texas. And in 62, they got married. He married my mother. And so it was an application, and they brought her along. His boss helped him through that process. And so that story I heard a lot, right? And I grew up hearing that story. I know some of the challenges that they had. My parents were very proud, although we struggled. And as I didn't know as a child, but knowing now what I know about income and poverty, we certainly were not. I don't think we ever were lifted out of that in terms of finances. But they were very proud, and they did everything they could. My dad would have. He refused to apply for many of these services. He wanted to do it as best as he could. I think the only time we ever received some services when he was in the hospital for a back surgery that he had. So there's it's proud, and then you kind of think about it from a perspective and saying, there was really opportunities to help us out in many ways. And so my mom did as much as she could. We received a lot of benefits from the church. So she would find some way or the other to help out. And so my story is one that it never really felt, I mentioned community from the beginning. I grew a lot of friendships when I was young. I had a really good upbringing. And so, and my parents were very strong in that story. My dad has always been a super hard worker. He's worked long hours trying to go to school to learn his English, learn different trades. So he maybe wasn't physically present very much because of all that time that he needed to take, but very much a presence in terms of hard work, trying to get where you never settle or no. And his favorite saying is, everything that you learn will always help you. So never think that anything that you've learned is for bad. So
I've read of other traveling workers like your father, and it was a choice program, and that not everybody got to do this program, and it was hard, and it was a lot of traveling, and you moved as the crops moved, whether it be in California, Texas, up through Oregon and Washington. Did you travel? Did you travel as a family when this was going on, or was this early in your dad's career?
no, this was early in my dad's career. He made a strong effort to try to leave that. He knew that it was very challenging work, wasn't, and one that wasn't really fruitful for financially in terms of trying to raise his family. And so he would get, I hope I'm not saying this incorrectly, I believe it was like $30 for the working 24 hours a day, 7 days a week for his family. And so, I mean, you still have to go back and try to take that, what does that value mean back then? But still, it was a lot of work that he did. And so as he moved from one role to the next, from one farm to the other, or one ranch to the other, as he would say, he always tried to find increased benefit. And he also had the challenge of as he grew, I mean, his bosses liked him and would maybe offer him a different role, but had a challenge with others who didn't want to hear from a Mexican in terms of being told what to do. And so, race had something to do with that. And so he tried to grow as much as he could, but there's always those challenges of being offered that. And so
I want to talk about those challenges at some point, but I also want to ask you, because I tend to dwell in the space of the assets that exist. When you speak of your father and your mother, you have such there's such warmth in your voice. What did they give you that you take today and you give to your kids?
my father gives me for sure the gift of remembering how important it is to work hard, and the value of hard work. He also brings me a reminder of humility, because, you don't know where a person really has been and all the struggles that they have. And humility is highly valued in my book, and in our families. My mother gave me the gift of knowing that she was always there, and the importance of finding one way or another. When I was in college, she didn't have a lot of funds to say, here are some, I don't know, get you ready for your dorm. But she always had a way of finding, maybe making my favorite food, or, she always had a way of offering her best. And she, in my mind, was one of those unsung voices that weren't, you didn't hear them as loud, but man, she was doing so much work behind the scenes. She did everything she could. Woke up early when my dad went to work, made sure all the food was there. And so love and was something I also received a lot from her so.
That's cool. And I know that carries for you to this day. Okay, I'm going to ask. So what was your favorite food that your mom made for you?
It was actually flour tortillas. I love flour tortillas. That's one of my favorite foods. It's one my mom, she was able to pull those things out so quickly, it wasn't funny. And it's oddly, my daughter learned how to make them. So I never learned. My husband and my dad always make fun of us because of all the kids in our family. None of us learned to make them like my mom did. But thank you, YouTube, and the internet for showing us different ways and people sharing their skills. And my daughters learned.
What was your favorite thing that you would put with them?
Actually, beans.
Right on.
Yeah, just plain beans. I love beans and tortillas, flour tortillas. There's just
Oh,
something when
that's
they,
special. I
yeah,
love that. And I hope that we can share some of this. This is so good.
yeah.
I want to talk about some of these challenges that the Latinx community faces. You had mentioned, we know that there still is a great deal of systemic and structural racism that exists for Black and Brown people. What are some of the things you've noticed in your lifetime, whether it be from stories from your father or from things that you've seen in the community?
Things that I have seen, growing up, you asked me about growing up, and uh, I had the privilege to go into many of my friends' homes and to see their life and get to know families. And so, again, that was a different lens, right? And I look at the what was available to them. I feel challenges are often wages, in terms of some of their salaries. Women in are, it's even harder, right, for Latinas to make a higher wage. I also see challenges in this area of housing, and I say that because we've been working on our addressing social determinants of health a little bit more, and I shouldn't say intentionally because we've always been intentional, but working specifically on capturing that more intentionally. Um, and part of that, so when we looked at, we received a grant, or we were aiming for a grant, the WPP grant. And in that, we wanted to look at what it was the area that we wanted to work on. And looking at the data and why some of our families come and see our social services, housing came to bubble to the top. And so we know that they go to see our social services because of maybe lack of housing, application for housing, quality of housing, maybe they have opportunities and they have nothing else. We also have a lead outreach program that we know we go into homes to help families troubleshoot and try to figure out where the lead, why the child might have higher lead levels, or how can we mitigate it so that they don't increase or have any. In some cases we do it proactively. And so I think housing in this community is something of importance, and I would love to see that improved. So we know that that's an issue. Immigration sometimes, and some of the rules that are going on. We know that some of our services have not been accessed because some people are afraid of what it might mean to their applications later. So we've had some people who negated having our assistance in one way or another, whether it's the women's, infants and children's program, or another service that we have. So those, I would say, from my perspective, I could go on for a long time on what other things are, but.
You know, I want to tug on both of these, but I want to start with the immigration. Tell us and tell our listeners what this means and what it means to the health of the people from the community's perspective.
You know, immigration in and of itself may not have, it's not like you immigrated here and you have to take the whole thing together, right? Many times people are afraid if they don't have the right status. That it's and I can't say it's just I don't know if I can explain it correctly, but it is a concern that you have no matter what. You're walking down the street, or you're going, you're driving somewhere, and you're afraid to get caught by the police. You might be going through something. Maybe your landlord is maybe not offering the highest quality housing, but you're afraid to say anything because you might get caught. And so it's a constant thought that happens for those families who might have not been, who might not have their full status here in the United States. People who come here, whether from whatever country they come here for a reason. They usually don't come here because they're doing so wealthy and great in their country. And for that, immigrate and go through those challenges of immigration. It's often they're trying to do their best and help their families. I'm a parent. I would do as much as I can. If I knew I couldn't put food on the table for my kids, you do everything you can, and coming to a different countries where you think that there's going to be more resources. But it's a constant. I think it's a constant fear. It's a fear of I would like to have my status one day, and how do I do that? And what programs am I participating in now that might affect that status? So I have not been in those shoes, so that's why I say I hope I can describe it. I can hear it from some of our participants. I know that it's, I don't know that I myself can fully capture it, to be honest with you.
You gave me a sense of the, you used the word constant several times. And I can't imagine, whether it be taking the kids to school or going to the grocery store, going to the post office, doing whatever, including going to a place where we are supporting health, that somebody may say, I'm sorry, sir, but you got to come with me and you're going to have to leave, or we're going to detain you, or whatever. That constant set of fear must really weigh heavily on the individual and the families, especially if families are maybe, they're getting by, but they're not getting ahead because of any number of reasons.
Mm-hmm. Yeah, it's a thought that's in your mind through many different things that I myself wouldn't even think about necessarily, but it's pervasive, right? It's things in many different ways that I think it affects you.
Rosamaria, tell me then about this idea of housing and how it relates to the health of the community. You had talked about housing and lead. Why is that so important?
Oh man, lead has such an effect on a child's brain and development. And when they're more apt to get lead is when they are at that a very critical stage in life, right? In growth. So as they start crawling, they start going to that window, they start looking out that window, and their nose is pretty close to that windowsill, and it, it's it's if the house itself is not was built before 1978 and maybe wasn't taken care of, and there's any chipped up paint, there's a high risk for that child. And it's not just for the moment. Some of that is you can't go back on it. Once you have strong effects in that, and you see them, you don't want to see effects of lead in a child because you can't change that. And we don't want them to be the litmus at all. We want to be able to test proactively. We want to be able to engage with our families to let them know this is how you can help prevent it, if possible. We were previously lead poisoning was considered at 10 and above. But we've always worked with families at the stages of 5 and above. So really trying to be proactive. We have a system in place where the doctors are testing for them at regular intervals. Our doctor that works with us specifically in this department and lead outreach has very strong connection with us, and so we know that our kids are getting tested, and that's what we want. And we've really decreased that prevalence rate. When we first started, I should have pulled those numbers up, but it was about 33% prevalence rate of high, and we've brought it down to 2%. Or we've seen it decrease. I can't say it's just us because it's again, everything is so multifaceted, but we certainly value the importance of process and to make it as part of the way we do our work to test our kids. Our 16th Street, as I mentioned, has a Women, Infants, and Children's program where we also do lead testing. That is not part of the Women, Infants, and Children's program per se, but we work ways to try to make sure that our kids are tested. That is very important. So because it leads a lot to their how they might be doing in school later on. It just their brain development, and it's just I find it a very important piece.
What do you tell parents that they can do? And I really like this because it takes us not only from the idea of testing children, but then you're taking it to the community level. What do you tell parents that they can do to support the health of their children in this instance?
So it's important to try to have healthy eating. We don't want their iron levels to decrease or the hemoglobin levels to decrease. We want, because once those decrease, there's more opportunity for lead to take those spots, as we'll say, very in not medical terms, right? But so healthy eating in terms of that. So having the right amount of variety of foods is important. Making sure their hemoglobin levels are okay. And washing their hands is super important because kids are kids. We're out there, we're all of us when we were kids, and playing and touching and getting stuff on our hands and making sure that's all washed off before we go ahead and eat. And then making sure the house is in decent shape in terms of no chipped paint. Kids can get a hold of that. They can sniff it. They can grab it and put it in their mouths. They're very curious. That's how we learn about our world, right? We touch, we feel, we put in our mouths when we're little. And so being careful about that is very important. And having a good diet and can help them mitigate as much as possible.
So we're really talking about the idea of environmental lead rather than lead in the water, where it's in the paint, in the air, in the dust, in the soil, and things that where the living conditions are for people.
Mm-hmm. So I will say that is where that was a big portion, is that we see it in the paint. and chipped paint in the households. There are other areas where they could be coming in from. There is a certain pottery and certain things that we watch for, but in large we see that the big impact is paint. Some other as well is some hazards from the parents where they work depend on what they're bringing home as well. But what I do want to say is that I don't take that for granted. I don't ever want to think that we know it all at every point. So our director has been working with universities and thinking about how do we take a look at that and research and be part of it and constantly learn. And so that is one thing I really love about our role, is that we know that it's there's a passion to continue to do best and better. And so that is our experience as of now, and we will continue to take a look at the data. We'll continue to see what's out there and where kids could be getting lead and be part of the solution. It's super important.
Yeah, we know that lead is more than just your area, but it's throughout the city, and that things that we learn in your community are things that we can share with others in this space.
Mm-hmm.
Rosamaria, can you tell us about the health of the community beyond lead? What are you seeing through the initiatives program or anything else that you're hearing and talking to the providers, talking to the community members? What are some of the strengths and what are some of the concerns that you may have around the health of the community?
Some of the concerns that I have is we've talked a little bit about housing, and we've talked about the community. Another thing that I often hear is safety in the community. And so what are we, some families don't feel as safe to go outside, to be active, to enjoy. That is another thing that sometimes I have heard quite a bit. We also have an HIV program, and one thing that concerns me a little bit is our LGBTQ community, in terms of I feel that some don't feel as safe as well, and providing opportunities to engage is another important piece in my mind. Right now, I think that there's just a lot of challenges in terms of lack of work or lack of, the types of the work that many of our patients do, or this community does, is a lot of service work. So that and how that's relating to COVID and to other health concerns is another. And the health of our community overall. So we do have an environmental health department that has also worked very hard. And I'm happy to say, actually, we just got a Mandy Award as well, two. One that was the People's Choice Award, and the other was for our work that we did in the community. And so as you know, that was given out because it was given out to public space that builds community. So that is important to me. I think mental health is also, as many other people have been struggling with, especially now during COVID, is an important piece that we have to keep an eye on as well, and try to offer services and assistance. So what are the great things that are happening? I would love to say that at 16th Street, I think that it's really important for us to continue to listen to the community, right? So I just touted the Mandy Award, and really that work that we did along the KK River was because we heard the community. What were their concerns? So we knew we wanted to naturalize that river. We knew that concrete had to come out. And so MMSD has been working really hard on that. And so when houses come down, in order to allow for those things to happen, and the community is coming in saying, look, that space is empty and not such great things are happening there. And so we worked with the community and engaged with them to identify ways that, how can we mitigate this? Let's make this a space that's a public space that we all like, we can enjoy, we can participate in, and mitigates other crime or other issues that might be happening there. Let's bring in art. Let's bring in a space for kids to play. Let's bring in a garden. But all of that was hearing the voices of the community. So the community often knows what to do and what they want, right? Nobody has to come in and say this is the right thing for you. It's just a matter of helping that happen. Make that happen.
It happens every day.
Yeah.
People well-intentioned and not so well-intentioned tell
Yeah.
the community what to do. But I do want to ask this because, you know, you're a community health center.
Mm-hmm.
Is the support for the outreach universal, or do people go, no, people got to come to us. We're a clinic. We shouldn't be doing this outreach stuff, this stuff at the river. That's not important. Seeing patients is important.
Yeah, no, I'm happy to say that no, I've been received a lot of support from our agency in terms of leadership, in terms of our own staff and the work that we do. And no, it definitely goes beyond the four walls of our clinic. So in my department, we have our HIV department, we have our environmental health department, we have the Women, Infants, and Children, social services, our parenting resource center, healthy choices, and AmeriCorps. And so I name all of those, and as I go through that list, we all have there's a community component to all of those, right? So there's our HIV program has not only our HIV care, so assisting and connecting our patients that have been diagnosed with HIV, understand the issues and understand you're going to be okay. There are resources and we'll connect you to them. But also having that prevention arm and reaching out. Let's go out into the community and encourage, you know, the condom use, the testing. Let them know that there's services such as PrEP. So there's medication that you can take in order to help reduce your chances of getting HIV in case you're in a relationship with somebody who does have it. You know, so it's that prevention piece in HIV that is really important as well. Our environmental health department, I already mentioned our lead outreach program going out to homes, but our sustainable development program does work a lot out in the community in terms of, I just mentioned the KK River. That's an example of some of how we engage with our community. And we're also, I don't think I mentioned this to you earlier, but we have 3 school coordinators. We have a partnership with United Way, and so we're at 3 community schools and the community school really is almost a hub of engaging with the community, with the leadership at that school, engaging with the parents and addressing issues that they might have. And so clearly they have to be very alert and connect with the communities at that school. And the surrounding communities, because again, those who are going to that school are likely to live right around that school. So that is really important. And not only, so I just gave you some examples, but also the partnerships that we have. I can't say that we alone will do anything. We definitely have the passion and the drive, I think, to want to do as much as we can. And we know it's it's a partnership. There's a lot of different pieces to help, and what our ultimate goal is to help the community. And so that looks different, and there's no one answer to that. So,
yeah, what does it mean to you to have the leadership support you to do that engagement?
it means everything to me in terms of I'm in the right place, right? Because we are a community health center. And if we don't allow ourselves to go out there in the community, then and underscore that, then we are in essence trying to say we have the answers and this is how we'll make you healthier. But we know that it's important to help people to find ways to, for example, to make sure they have services or are connected to services, whether it's housing assistance or other programs, domestic violence. And so if we don't go out in the community, we don't understand that, I don't know how we would be able to say that we're trying to work towards a solution if we can't hear and hear it straight from our patients in our community.
You know, maybe it still says that the organization still has heart.
Oh, we definitely have heart
You
and
have heart.
passion and engagement, and I love that. I absolutely love that, and I cannot tout that enough. I cannot. I'm a little biased, right? But I think we have a phenomenal agency that it starts there. It starts with that trust and that genuine.
You know, I've been in I helped to train medical students and work in a family medicine department and family and community medicine, and we strive for that. But it can be challenging with the push to see patients, to generate revenue, and so on. I think we understand the importance of it. I don't think there is not a physician that wouldn't understand the importance of engaging the community, but sometimes they don't know how, and sometimes we just get lost in the other things. But it's so encouraging to hear all of the things that you are doing that make that possible, and having the support from the leadership. As you said, it's everything. Can you tell us what you see for the future of the Latinx community around health in Milwaukee?
I I will say that one of the things that we've been working on for our social determinants of health projects is not only keeping that information to ourselves, but trying to have a bigger impact on our community and understanding. In fact, we're at the process now that we're reaching out to stakeholders and try to understand what they feel some of the root causes are, and what some of possible solutions could be. And that's important, right? I hope that we can work even stronger together to and align our resources to make an impact. We're also working with on a process that hopefully it's not a done deal. It's something that we've been working on with other agencies such as other health systems to try to create a community information exchange and trying to close those loops with referrals. Oftentimes we'll make referrals to places and we don't really know what happened. Did they go? Did they not? Is there a way that we can share some of that information for purposes of care coordination, for purposes of making sure that we're not using resources for something that they already have. Instead, that we focus our resources on gaps and how can we offer this patient something that they're not receiving, or how can we connect with that other agency or organization, or to complement the services that they're receiving. And so what I would like to, I'm hopeful that that future involves more care coordination and more services for our patients. So as part of the community information exchange, I find it very important that that be a bi-directional communication, right? That we not only share, hey, this patient or participant is interested in this, and that we learn more about the organization and have specific standards and say, look, this is, maybe our patient went there and didn't have that care that maybe they anticipated. Let's work together. I don't think that was your intention. I don't, just like us, we might make some mistakes or maybe something happens. We're looking at how do we improve. And how do we work together and understand what some of these patients' needs are and address them, offer their services, offer products that are appropriate, offer the services in Spanish and other languages. So we talked a lot about the Latinx community today, but our community is changing. Milwaukee has been very segregated. There's no secret to me or to you or to probably any of our listeners today. And it's changing. I'd like to say our community is changing. And so are we reflecting that? And so that's a challenge to all of us to say, what are we doing to service our community? Are we always meeting the needs? So to help them.
It seems like you're looking ahead and you're looking for what the history was, but you're also looking ahead, and the idea of a community information exchange that would be bi-directional seems like a natural extension of what you already do. And so that is that complementary next stage, so you can make sure that you filling the gaps and not having, the resources are not ever expanding. And so we need to be able to make the most of what we have. Can you tell us about some of your practices that you use to keep in touch with the community?
I going out and talking with them. Me personally, our team has many opportunities, whether it's neighborhood meetings, whether it's the leadership teams that they have that they're working with, whether it's our patient advisory committee, whether it's opportunities when we go out to events that we're reaching out to the community. And so I love that we have those opportunities to be out there, to not just at meetings, but really an engagement with people. Because my mom always said, right, every head has its own world. And so, when you get to meet with somebody, you start to hear their story a little bit. You think about things that you would have never thought of. I mentioned that I could only talk from my perspective for the Latina experience. There's so many different perspectives, and we have immigrants from Burma. We have other people from different countries, different parts of the United States, and even right across, right here. And so they just have a different perspective. Their experiences that they have are maybe different than mine. And so I love to listen, because I feel like it helps add to solutions. And so we have a lot of opportunities. As I mentioned, all of the departments, I'm happy to say, have a component that we're out there. We're engaging. And we're engaging for various reasons: to listen, to help people know what's happening, to be out there, because we know that, hey, if they don't come to us, we'll figure out a way to get out to them. So we're out there for various reasons. So I personally do like to take opportunities as much as possible to be out there. It's been a while since COVID that I haven't had a chance. So it feels a little distant right now. So I feel a little bad right now, but it's, but even I'll tell you, recently we had, so our Healthy Choices program also has Latinos por la Salud, so Latinos for Health. And the work that that team does is to really help people, those who are participating, grow their leadership skills, and grow their leadership skills in particular to health, and to bring a voice to that. And I was able to participate even virtually. So, like I said, the work continues, and I love the passion, and COVID doesn't stop us, one way or another. We've figured out a way. And so the Healthy Choices team has done a lot of virtual work. It's not, as you say, in person. So we still miss that, and we still want to go to that. But they're doing what they can. And participating even in that meeting, I was impressed. I was so impressed with what they brought forth. I was so impressed with their senses were, what they experiences were, and how they presented themselves. I was impressed by the heart that they too had, and the passion. It was a Friday night, and it was from 7 to 8:30, I think, or 6 to 8:30. And so they were there. They were not only there, they were present from each other. And to me, that it spoke volumes. So we continue to offer services as best as we can for our families, and trying to be as innovative as possible. So COVID has really pushed us to think a little bit differently. I'll just give you just a few examples. Our lead outreach, I gave you one example of our Latinos por la Salud. Our lead outreach program is trying to use Zoom calls to see if we can kind of do a visual of their home, if the family allows, is interested, and give feedback that way. We've done virtual school, summer school programs where we've given families, dropped off materials and did projects with them from a distance. We do some cooking classes as well, and so it's been a lot of work. Our social services team is engaging with families as best as they can, picking up things, dropping off things, amidst all the work that they do. Incredible need. There's been an increase in our patients or participants who are participating in the Women, Infants, and Children's program. All of that work is being done telephonically. So it's, it's participating in those things is a little more challenging right now, but doing the best we can and trying to reach out.
That's fantastic. Anything else you want to tell us at this time?
Oh, if it's about 16th Street, I could talk forever. So we have to be careful with that question with me. But I think what I hope that really came across is that such a passion, a love, a trust for the community, a belief in the community, a knowing that we, as part of the community, have we have to work hard, and we don't take it for granted. We will continue to aim for those high quality standards, for those awards, not for the sake of having the award, but because of the high quality standards that our patients deserve. And so aim to continue to always listen and to be part of engaging with families. We've heard often that people trust us, and so they like the space that they're in with us, and we don't take that for granted. We really try to build on that and know that that's really important. I really look forward to continue growing our partnerships. We have many partnerships, and I value them just as much. Many other organizations are doing great work as well. And so joining that with them to help our patients and our community is just super important.
You are really a person of the community, and I think your organization is just outstanding. I would love to have you come back to highlight some of these programs, whether it be in housing and lead or the community health programs, so we can actually talk to some of the people that give that the heart. Rosamaria, this has been a joy for me to talk with you. I learn new things, and it is always a pleasure to work with you and to support the needs of the 16th Street Community Health Center. If people want to get a hold of you or any of your programmings, how would they do so?
They can get a hold of me via, probably the easiest right now is probably just my phone, which is 414-897-5186. You can contact me. I'm happy to meet with people to tell them more about what we're doing. We just scratched the surface, really. There are many programs that are coming up. We are engaging with a CCS program coming up as well. And lots of learning, I feel like. So I mentioned housing, and I feel like the more I learn, the more I realize I have lots to learn. So happy to talk to anybody about anything I've mentioned today, and or anything. I just want to reach out.
Well, I hope you'll come back.
Yeah, I hope you'll have me back.
This has been a joy. Rosamaria Martinez from 16th Street Community Health Center, thank you for joining us today.